We just got done listening to Creedence Clearwater Revival's cover of Proud Mary, and I hope that you all can appreciate the pun that comes with that song choice today because it has to do with rolling down the river, rolling on the river, on, not down. And we're here to talk about the State Health Improvement Plan, also known as the SHIP. So there's a nautical pun for you today. Take it or leave it, totally up to you all. So we're here to talk about State Health Improvement Plan. We have a lovely presenter, Dulce Sanabria is here with us today. I have the pleasure of being able to work with Dulce. Dulce is on my team, the Strategic Initiatives team in the Public Health Division. And I think I'm not going to waste any more time talking at you when you came here to listen to the awesome information Dulce has. So Dulce, if you'd like to introduce yourself and get us going, while I invite folks to introduce themselves in the chat. So for those of you who have been here for a minute, you know the drill. If you could please pop your name, pronouns if you choose to share them, where you work, and I didn't come up with a really good warm-up question, but I'm just like so stoked for the sun that maybe if you want to share your favorite thing that you do when it is sunny to enjoy that part of the weather, that would be awesome. So think about it, throw them in the chat, and Dulce, go ahead and take us to the SHIP presentation.
Perfect. Thank you, Heather. So hello, good morning, everyone. Like Heather said, my name's Dulce, she, her, ella pronouns, and I work on the Strategic Initiatives team in the Director's Office in the Public Health Division. I will also say I like that warm-up question. However, I don't think my answer is very fun. I am going to be totally honest. I like taking naps when it's sunny outside and like you can feel the sun on your face, on your bed. So I don't know what that says about me as a person, but I like to stay indoors when it's sunny. Anyway, I'll go ahead and share my screen. Let's see. Okay. Can I get a nod or a thumbs up that we're seeing the first slide? OHA's State Health Improvement Plan. Cool. Perfect. Thanks, y'all. So yeah, again, I'm here to talk about the State Health Improvement Plan for OHA, and specifically about the health priorities for this redevelopment that we're doing right now. Let's see. Okay, I'm still getting situated. Hold on. There we go. So I include this picture, this slide here, about our showing our engagement team for the State Health Improvement Plan, because we've been going out a lot and having these conversations. So there's a lot of folks on the team that are doing variations of this presentation, of this information sharing. So if you see familiar faces, familiar names, know that, you know, a lot of times we're talking about the same thing. And also, I believe we have come to this space before, so thank you, Heather, for continuing to let us join this space. And thank you, everyone, for continuing to participate and show up to talk about the State Health Improvement Plan. So today, I do have a bit of a quick agenda, although there's a lot of information within those quick agenda items. We'll first do an overview for the State Health Improvement Plan, sort of reminding folks and grounding us of like, what is this process? What does it mean for OHA and for our partners? And lessons learned from our previous SHIP, or HTO, as some folks might know it, Healthier Together Oregon. We want to share a little bit about how we've been engaging community throughout this redevelopment process that started, gosh, I don't even know, like a year ago potentially, and share some draft priorities that we have for the new State Health Improvement Plan, as well as an opportunity for you all as partners, as folks that we work with, to share feedback. So first things first, a quick overview of the State Health Improvement Plan. So for a little bit of context, this is a process that we do every 5 years. OHA, as a state agency and as an accredited state agency, updates its State Health Improvement Plan every 5 years. And this is actually a two-part process where we first conduct a state health assessment or a SHA. And this is where we look at all the data that's been collected. We sort of collect this all together to look at and get a picture of what are the current health trends that we're seeing in the state, any like challenges, sort of what are some of the things that we're seeing. And this can kind of give us a jumping off point as to what should we be focusing on for the next 5 years in our public health work. So again, two-part process, which is partially why it takes a little bit of time. And then here we have sort of a visual of that same concept of like it's cyclical in nature, happens every 5 years. So as you can see, our state health assessment here in 2018 is what led to our previous state health improvement plan, or Healthier Together Oregon, that was running from 2020 through 2024. And then we started the state health assessment the past year. And now we are in the process of updating the state health improvement plan for 2025 through 2029. And we get to do it all over again come 2028, 2030-ish. So just another reminder, we are here. We are currently updating the state health improvement plan. Okay, so a little bit more of like, what is actually the state health improvement plan? It is, like its name, a plan. Essentially, it's the roadmap that outlines our different strategies that we might want to use to address the health priorities, the health challenges that we're seeing across our state. So these strategies can do this by informing policy, informing partnerships that we take on as an agency. So, we work with Department of Transportation, Department of Education, and also informing the investments that we do as OHA, and also with our partner state agencies. The plan is also meant to ensure alignment with other strategic plans like OHA strategic plan, the big one. And also, this isn't on here, but our community health improvement plans. So our CHIPs, or community health assessments, our CHAWs. So it is really meant to help with alignment across the different levels of public health in our public health system. And thank you, Heather, for outlining those acronyms for me in the chat. So to share a little bit more detail of like what are the different parts of the ship. Again, following that nautical theme, what is the deck? What is I don't know other parts of the ship. But this is a big document that includes various parts, one of which is the framing. So here is really where we take some time to talk about what are the values for the work, what is the mission that we're working towards, and sort of the vision that we have for the next 5 years. 4 years? 5 years. And this is where we can also talk about equity, access, institutional biases, and also the current landscape that we find ourselves in. So right now we know the current landscape in public health is really challenging. So this is where we can take some time to sort of acknowledge that and talk about how we're moving forward. For priorities, which is what we're focusing on today, is sort of a high level identification of what we really want to focus on. So what matters most to us right now? What are we hoping to achieve during the implementation of this ship? And the strategies, which is sort of a level below that, is how we intend to do that. So what are the actual actionable steps that we're taking, again, as an agency, as a division, or with our community partners to address those priorities? There are also a huge part of this are metrics, so some of the data that we're going to be measuring across the 4 years to make sure that we are doing that work and how much we're how the work is progressing. I will say I am not the strongest data person. There are very strong data people on our team. So if that's something that folks are curious about, there's definitely opportunity to connect there. But I will not be that person. So some of our sort of lessons learned from our past state health improvement plan or Healthier Together Oregon. These are the priorities that we had last time around. So these were developed with a community steering committee, and the priorities that were identified were institutional bias, adversity, trauma, and toxic stress. We have behavioral health on there, economic drivers of health, so things like housing and transportation, and access to equitable preventative health care. So those were only five priorities, but they were quite broad priorities. So throughout the implementation of Healthier Together Oregon, which also happened to happen during COVID, some of the lessons learned were that these priorities are really important, but they felt challenging to accomplish. Again, they feel very broad. And so folks were also interested in clearer priorities, making sure that we can identify what we can do as public health with the resources available, with the power levers available to us. Again, this is sort of feedback that we've received both from internal staff and also from our external partners working on the state health improvement plan. So with that, I'll move into this section, which is sort of a follow-up from the last time we were here, where we've been engaging community in like fall, winter 2024. And so we've collected some of that feedback, and now we're wanting to incorporate it into this redevelopment process. So I'll share a little bit about that. So again, hopefully some of y'all were here back in November, December when we did this presentation in this specific space. If so, again, thank you for continuing to show up. But as a quick sort of recap of what we did, November, December of last year, our team visited 12 unique community spaces to share about this work. Essentially, it contained some of the similar information that I just shared. So an introduction to the state health assessment and an introduction to the state health improvement plan, sort of what are these and how do they play out in our public health work. Additionally, we shared opportunities for how folks could get involved, including a feedback survey, which I will share some of the findings from that, and a funding opportunity that we shared as well. So a quick refresher for the feedback survey, we asked folks very, very broad questions, just about thoughts on health to sort of ground us into like, what are folks seeing? What are we aiming for? And so the first question was, what does being healthy mean to you? The second question was, what does it take for your community to be healthy? And then we did also ask, once we got those responses, how do you define your community, so that we really are understanding what we mean in these responses. So we definitely we looked at all of these, we pulled out overarching themes, and so that's what I'll be sharing today. So number one, what does being healthy mean to you? One of the very common things that we saw was sort of a trend of wanting to lean towards holistic wellness. So not just physical or mental well-being, right? So our emotional well-being, our financial stability is also really important for our physical and mental well-being, and spiritual well-being as well. So making sure that folks' needs are being met in each area to kind of reach that holistic wellness and health. For what does being healthy mean to you? Another big theme that we saw was connection, actually. And so this was kind of broken out into a couple of different themes, I guess. So connected socially, making sure that we have access to community spaces and places that speak our languages, that are accessible to our needs, that share our culture. So just feeling connected within the community that we're in, and feeling like we have a like a safety net with our community. Connection, like personal connection as well, again, with the place that we live in, with our land, with our environment, and feeling like we are supported and can live our healthiest life there, in that place and where we live. Finally, for what does being healthy mean to you? We have access to low barrier visits, which seems straightforward, but also what does low barrier and access mean? All of these are making sure that our visits to providers are affordable, that they're local, that folks don't have to, travel super far or have really expensive travel to get to a provider. That they're also socially and personally affirming, so that they're affirming of our experiences, that they're affirming of our identities, and not perpetuating further harm. And also making sure that this access includes all of our providers, so behavioral health, for dental health, emergency and preventative services, prescriptions, all of the above, making sure that all of these are included in removing barriers. Now, for what does it take for your community to be healthy? This is sort of a, again, like theme running lists of things that we heard from folks, which is access to resources for well-being. And again, this is where connection came in, community, making sure that we have and feel supported by folks around us, affirming to our, again, lived experiences, our identities, culture, access to education, um, healthy food that is, culturally and nutritionally relevant. Also, any dietary restrictions, making sure that we have access to the foods that we need for our personal needs. Housing is really important. Feeling connected to nature and having access to safe third spaces, and also employment and income are all different resources for us to feel healthy, and to be healthy. Other themes that we heard for this question of what would it take for our communities to be healthy, one of the big things that we heard was access to community funding and support systems. So what does consistent, sustainable funding look like for our community partners that are providing some of these wraparound services like healthcare or transportation, food services? Also, we saw a lot of folks say support for surviving trauma and exposures to hate, disregard, disrespect, and oppression. So acknowledging some of the more systematic um, factors as well that are affecting our health. And what does it look like for us to address those and have that be a part of our public health work? Okay, so this is our third part where it all comes together. Now that we are updating the state health improvement plan and we're looking to create new priorities, taking the feedback that we got from Healthier Together Oregon, taking the feedback that we got through the fall that we just shared, sort of where are we landing with these new priorities? I will share this drafted list of priorities for the new state health improvement plan. You'll see there's definitely, I think, some overlap with Healthier Together Oregon. It also grew in numbers. So what might it look like for us to, connect some of these and shorten the list so that we really have a focus? And I will go deeper into each of these priorities, but here's the list for now, sort of an overview. We have healthy environment, emergency preparedness and response, health across the lifespan, disease prevention and health promotion, physical, mental, community safety. We have mental well-being and behavioral health. And then finally, equitable social conditions. So again, lots of potential overlap as well between these, but that's where we will get into it afterwards. I think we like to share some considerations for these priorities of like who's actually going to be doing this work. And again, to speak to what can we actually do as a public health system. So our public health division is going to be the primary sort of organization working to achieve these priorities. However, we do also have some connection locally with coordinated care organizations. So each coordinated care organization needs to choose two of the SHIP strategies to work on throughout their work as well. So even though we're talking about priorities right now, our priorities will dictate sort of the strategies that come out of this. And so that way, we do also have some um, leverage, I guess, with coordinated care organization or CCOs um, of supporting our state health improvement plan work. So again, these still feel quite broad. So what are we actually thinking when we say healthy environment? Um, these are some examples, definitely not exhaustive, but sort of along the lines that we're thinking are things like monitoring and treating drinking water systems for public water drinking and making sure that we have safe water. For healthy homes, making sure that we are prepared for environmental hazards. So we've been seeing more and more recently extreme heat, extreme cold, and how can we prepare homes for that? Also preventing heat and wildfire smoke related illnesses, hospitalizations, or death. So again, in recent years, we've been getting a lot of wildfires. So how are we helping prevent those kinds of illnesses and hospitalizations? Um, and then along this line is also things like safe food handling. So preventing foodborne illnesses, making sure that we have um, trainings for food handlers. For emergency preparedness and response, I think really um, what we're thinking here is making sure that state, local, and community organizations are um, collaborating and that they're communicating so that we have communication practices and systems set up for before the time that an emergency happens. So this, for example, can also look like making sure that we have communication in different languages and formats for folks that don't speak English. Um, Radio communications as well for, places in Oregon where we don't have readily accessible Wi-Fi. What do these different formats look like to make sure that we're able to reach folks promptly with important information during emergencies? Another one of sort of what we're thinking under emergency preparedness and response is making sure that our response systems are locally and culturally relevant. So, for example, some of this might look like culturally specific food boxes, or if there's any dietary restrictions or needs, making sure that that support is available in our response systems during emergencies. And also making sure that our response systems have the resources to respond to the different needs of our diverse communities. So, for example, making sure that folks have appropriate evacuation support for folks using assistive devices. For health across the lifespan, I think this is sort of, kind of a very all catching one. But this is just policies and programs that really promote and improve health for folks, again, across their entire lifespan. So from pregnancy through infancy, through adulthood. So this can look like making sure that folks have access to routine immunizations, making sure that folks have access to preventative health care. Another population that we, work with a lot are our youth. So how are we utilizing our school-based health centers and making sure that they have the care that they need? Reproductive health care services as well is on here. Um, for health across the lifespan continuing, we have things like dental visits and screenings, making sure that folks have access to that throughout their lifespan, cancer screenings as well. With older adults, we've seen fall prevention is important. So how can we support that work? And again, access to culturally specific foods for example, women, infants, and children, or WIC. Um, Again, this might be where we're seeing some overlap, but disease prevention and health promotion. So this is really making sure that we have culturally tailored and specific disease prevention education and interventions. So for things like tobacco, alcohol, and other drug prevention, um, immunization and vaccines are on here again, and then also things like STI testing and treatment, making sure that these are specific to our community needs. For physical, mental, and community safety, this is also speaking to sort of some of the um, larger or more upstream factors of health. So things like what does it look like for folks to have to live in neighborhoods and have access to clean, safe parks with accessible spaces, for folks to connect with each other, for folks to connect with nature, be outdoors. Um, that's also important for health. So what would it look like for that to be ensured in for all of our communities? Um, as public health and public servants, so things like doctors, social workers, police, um, what would it look like for us to help support them and train them so that we can better uplift folks who have experienced violence and we're not perpetuating further harm? And for this priority as well, things like what are the institutions and systems that are working to remove um, again, some of the more systemic oppression that we're seeing. And also for adverse childhood experiences, what would it look like for public health to support the prevention and intervention of that, um, to contribute to this community safety again? For mental well-being and behavioral health, some of the potential examples that we have here are making sure that there's mental and behavioral health support at schools through school-based health centers. Again, community-specific engagement and education that can support injury and violence prevention, suicide prevention, substance use prevention, harm reduction, and overdose prevention as well. And finally, we have equitable social conditions. So this one is again kind of expanding it a little bit more to the systemic conditions that we see. But our hope is that folks could do the activities that they want. They can go to school, they can work, they can play, and exercise without barriers on their individual health factors and where they live. So this can look like things to access to health insurance, language access, and also, again, making sure that we're expanding our access to fresh, nutritious food and programs that support these services for all of our communities. Okay, so I just talked for like half an hour straight. So I'm gonna take a breath, but I think I will open it here first. There are a couple more slides with like um, just surveys and feedback that we're asking for, but I like to pause here for any like first reactions, questions, comments. So I will open it up. Yeah, I see a hand. Hi, Nelly.
Well, good morning, and thank you so much for such a comprehensive presentation. It's really a lot of information over there, and I see that you cover most of the aspects, and great job. So I just want to talk on behalf of Slavic and Eastern European community because I'm here a representative of Coalition of Slavic and Eastern European community-based organizations. And we did our assessment for the community and find the gaps and see the way how we can address those gaps. And we actually um, produce a report of our findings, and I'm just wondering if you can use this on your work plan. And also, I want our community representation on any work you do. Uh, Regarding what I can add, we already described on your presentation that we can provide on the community safety slide, you were talking about that do trainings
Mm-hmm.
for providers on the violence and such and such. And also it would be better to provide additional training how to work with the communities um, who resilient to who doesn't want to, for example, vaccination. And it
Mm-hmm.
just, some culturally specific communities that for them too hard to understand general concept
Mm-hmm.
and just to provide education on the culturally specific way. Thank you.
Yeah, thank you. Uh, yeah, go ahead, Heather.
I was going to say, Dulce, there's another question in the chat, but I want to make sure that you got your note down before I
Yes,
ask you a
thank
new
you.
one.
Yes.
Okay. So we have another question in the chat. Can you repeat who were those who took the feedback survey? Was it just the general public of the communities you visited, or those who worked in the public health or healthcare settings?
Yeah, no, that's a great question. Just community spaces that we visited. So it was specific to um, community partners. I will say some of our meetings were mixed. So like, we'll have folks from um, like LPHAs, local public health authorities, or internal folks. So they might have taken the survey as well. But yeah, primarily was community partners that were in our specific presentations.
And thanks, Dulce. The question that comes to mind for me, and I'm wondering if maybe the wording of this question will help as folks are thinking about how to engage in the themes that have been gathered, is do you feel like the themes to the answers to the question of like, what does it mean to be healthy and what is community? Um, do you feel like those apply to the communities that you all are serving? Does the answers that were given resonate for you? And I'll pause there because I see we have another hand up. But ponder on that question for a bit too.
My name is Taya, and I work with houseless folks all over Clatsop County. And my grandchildren live in Portland and are Indigenous and Black, and they deal with a lot of racism. And I also, like yesterday, I had to sit with a houseless uh, woman who was being harassed just trying to get some rest before she got on the bus because I did not want her to get on the bus without any rest because she was so tired that she couldn't even keep her eyes open, and I did not want her to get accosted on the bus while she was pretty much so tired she was delirious. And so I have a really um, broad sense of health and what it means for healthy neighborhoods and what these different general folks in health looks like. My question is, when you're talking about trainings, are you talking about training like police, and are you talking about training like all of us and workers and everyone? And will the trainings be like things about trauma-informed care and things like maybe transformative justice and some of those types of trainings that maybe some of us believe in more than other folks, maybe because we work with these people? Is that what you're kind of talking about as far as coming together and working together to make a better community and a cleaner environment? Is that what you're talking
Yeah,
about?
Yeah, absolutely. So those trainings are definitely sort of, again, like you said, public, there's a lot of public servants, public serving folks like police, like social workers, like all of these folks. And so, um, yeah, I think that's exactly what we're talking about, of more like collaboration so that we're getting on the same page about like how are we not perpetuating that trauma and hatred. And I think to your point too, because this is um, on like a strategic level as well. What might it look like for us to partner with some of the systems that work with that population? So like Department of Corrections, I know that came up in a different community conversation as well. I will also, I do see Cynthia, who is on our team. I don't know if you have anything that you would like to add, Cynthia, but yeah, go for it.
Oops, I do. Hi, everybody. My name is Cintia Vimieiro. I use pronouns she, her, and ella, and I am the Healthier Together Oregon strategist, which is also known as State Health Improvement Plan. And I work very closely because Heather and Dulce are part of my team. So I love your question because I think as I'll just start with prefacing by saying we do sit on the public health department, right? So, but we're very aware that, and I say that, and I even have a picture, when you all to picture rowing boats, and because I always say that we all have a role, literally. Heather started with a pun, and I have another one here, all on the water teams, right? We all have a role to achieve health equity, and it's exactly that. Yes, the goal it is that we continue to partners with folks outside of public health, as Dulce mentioned, Department of Education, Department of Correction, Department of Transportation, police, and all that. But I just want to remind you all that we do have a lot, and those even had a picture on the slideshow that says our realm of influence that is really big, right? It is under public health, right? We do have some influence with other departments as well, but I just want to for transparency, because that's how I operate, it is a little lower. But yeah, and I see Dolly's hand as well. But yes, we do work with partners outside of public health because we all have a role in doing health equity.
Hey, good afternoon. So I want to just throw another way to think about the ship, or at least how I'm starting to think about it too. And hi, everyone. Dolly England, she, her queen. I'm the interim equity director. So, Sencha, I like keeping it real. Times are hard right now. And as money and resources become more scarce for both CBOs and LPHAs, we have to have a plan. We have to have a compass that can redirect where we're going to prioritize. And guess what it's about to be? Now, I think we will never make people happy as far as did we talk to all the right people? No, we never going to do it. Just because it's an impossible goal that I believe no one would be able to meet. But I do, because Sarah, Sencha, and Dulce's boss just asked me if they met with my team. I said, I don't know, because they've been in every meeting and community gathering that I've been in for the last like month. And I know that we're trying to get the word out. But if you haven't already gave feedback, and we don't know what things going to look like in a year or two, but I can tell you that we're going to come back to this document as a roadmap for what we heard are the priorities for community. Whether you're a CBO or you're an LPHA in here, give us your 2 cents.
Thank you, Dolly.
When I got to Clackamas County, or Clatsop County, I mean, I came from a community there where a lot of people work together. And
Mhm.
I moved here and we started a community partner meeting where all the different community partners get together and try to work as a fluid partnership. And
Mhm.
actually the POs and the police from both Seaside and Astoria started attending. And so now we actually have them attending our meetings quarterly. And so it's been a really interesting ride having our Bob team lead this meeting. And we just facilitate it. But we have like, I would say 30, maybe even 35 different community partners plus the police attending, just so that we can communicate about what we're all doing so we don't have to reinvent the wheel.
Mhm.
And I think it's probably one of the most encouraging things that I get to participate in lately because housing over here is really scarce and stuff like that. But I think, like you said, Dolly, with money being taken away and things getting harder and harder and harder, it's been really discouraging and hard, and it's hard not to burn out. And so this kind of thing is so encouraging to see that this on this level that everybody's trying to work together to make big change. And this is why I do what I do. And I think why we all do what we do. So thank you all so much for fighting for my grandkids and your kids and all of the, like you said, the generational. I really appreciate it. So thank you for giving me hope.
Thank you so much for the work that you do too and for sharing.
This is Cynthia. Can I just add another thing as we were talking about community engagement and the partnerships? Because I mean, that is one thing that we can continue to do without funds, right? Is the connections. That is like we can continue engage, we can continue talking, and try to do our best. And with that said, I want to share with y'all, and I will put a link here too. All this work that we're doing, we have a steering committee that is advising us, and actually they're making a lot of decisions about this proposed priorities. So the steering committee are about 24 people. We have representation from all over the state, and we have community organizers, we have community-based organizations, we have coordinate care organizations representation, tribal representation. We have our epidemiologist, Dean Seilinger, that many of you know him as part of the steering committee as well. So I just want to share that piece as well, because we are really, really working in partnership with all of you in different ways, right? So here to connect feedback through survey, I'm also working with 11 organizations that I can share this with you all. I have more than 1,600 responses from feedback as well, right? So, and now we're gonna share all this with the steering committee. So I'll put the link here on the chat. Please do check about the steering committee and the work that they are doing, because they are awesome. And we are really, really looking after their feedback to move this work forward.
Thank you, Cynthia. I think just looking at time, I will go ahead and just transition us to the last portion of it, which is essentially where I share yet another feedback survey. But again, talking to the importance of hearing back from y'all, the importance of us being able to collect this information, the questions that are in the chat, the comments that are in the chat. I'm also, taking note of those so that we can share it with the steering committee. And as these priorities are finalized, like Dolly said, what really is our compass? What are the priorities that are really deserve our focus and our limited resources for the next 4 years? So I'll go ahead and share, hold on, this last tiny bit. Okay. And I think that should be my slides. Can I get a confirmation? Thank you. Thank you. Okay, so this is the feedback that we are collecting on priorities. And as Dolly said, we have been in a lot of spaces. So again, I'm sorry if this is your second, third, fourth time hearing this information, but also thank you for continuing to engage with us and hear about this work, because it is important that we get the word out to community. We let folks know that this is happening and how we can get feedback from you all as folks doing this work day to day. So the feedback that we're collecting on these proposed priorities that we just reviewed, are there like top 3 priorities? So again, in the hopes of narrowing down so that we really have targeted focus and support, what might be the top 3 priorities on this list? Also, are we missing anything? What else do you want us to know that would be important for the steering committee to be aware of as we're narrowing down the list and finalizing this for state health improvement plan? So we do have the feedback survey. It is in English and Spanish, which I also know is limiting, but we have these open through May 9th. There's links here. There's QR codes, so whichever might be easiest. I will definitely ask Heather to share the slide deck out so that, if we're not able to get it open right now, this will not be the last time you see this information. But yeah, again, we have until May 9th when this survey will close, but essentially we're asking that question. What are your top priorities and what might be other information that's important for us to know? And if there are any further questions, we do have our emails here. Jamila has also been doing a lot of these conversations, so Jamila's email is on there, but you can also feel free to reach out to me at dulce.s.sanabria@oha.oregon.gov. I think this is where I leave it. There are a couple of like reference and optional slides, just again for further information. So like an acronym list. So if you're curious to see some more information on the slide deck once it gets sent out, there you go. But with that, I will stop sharing screen and yeah, call it a close. I mean, we have 9 minutes, so more questions. Happy to answer.
Dulce, thank you so much. And also side shout out for Cynthia too, as well, being here to answer the questions that this group has. There is another question in the chat, and I do want to highlight it because I think it's another piece of remembering and being mindful of the power and privilege that we have and don't have as we move through time, and where we live, and the things that are happening around us that are impacting our lives and the lives of the people in our communities. And so just want to honor that someone is bringing that to the attention of this conversation, and it deserves a pause. So Julia is asking, I'm wondering if OHA is hearing feedback on these priorities from Spanish-speaking community members at this particular terrifying time. Highly concerned that real fears of being abducted may greatly affect responsiveness on big picture issues like this. And I also just want to remind folks, and for some of you, you don't need the reminder. I recognize I'm coming from my own place of racial privilege as a white person in this country, that it can be really hard to concentrate on the things we want to improve in the system when we are not safe to exist where we live. And I really just want to make sure that that is stated in this space, and that I don't know, Dulce, if this is something that you would like to share your thoughts about the answer of OHA, taking into consideration the intersectionality of this work that we're doing at this current time in our history. No pressure. Easy question.
I can answer a little bit. Again, my name is Cynthia, and I do identify myself as a Latino woman. I identify myself as Afro-Latino, in fact. So I appreciate the question, Julia, because yes, we, in fact, of those organizations that I'm working with, I was just reading responses, and yes, we are able to collect feedback in a safe space through this CBOs that we're working with, to collect feedback about these priorities. And definitely was a lot of comment in there, exactly that the fear that people experience because of the climate that we are in, but they were able to express their feedback to us. So I'm very glad to report, literally, I was just reading this morning, we do have a good number of folks that we were able to engage, CBOs were able to engage in a safe space where people were openly with their fears and experiences of what is happening. So thank you for the question.
And I think it's a good opportunity that you all have heard me say this multiple times in this space, and I will continue to say it as many times as we need to hear it. We are here with and for each other. The work that we do, the work that you are all doing in your community is because you care and you recognize that everyone in your community is deserving of having safety, of feeling connected, going back to the themes that Dulce was sharing, having access to the systems and the programs that are going to help meet their needs, because the way that the systems have been designed is not to actually meet everybody's needs. And so if we're not here for and with each other, I struggle to see the point. And so please remember that you are here in this community. You have connections in your communities. If you do not have connections in your communities and you would like to build some, please reach out to those of us that are on camera right now. So I'm talking about OHA folks. I'm not going to put you on the spot there. I'm just like, reach out to but please know that we do this work together. This work cannot be done in silos. It can't be done individually. And that is also why you come to this space to nurture the community that we have together, to stay informed, to learn, and to apply what we are learning from each other back to the work that we're doing at home. And so for those of you that's a little too sunshiny, maybe a competition answer, that's okay, take it or leave it. But I just want to remind folks that this is the work, this is the point. And the revolution will not be funded. So the funding can get taken away. And that doesn't mean that the work stops. It means that we might have to pivot and we might have to change how we're doing the work for our communities, but it doesn't mean that the work disappears, because you are all here proving that. So I will stop there because I can talk about this for years and years and years, and we're a few minutes till time. So thank you for listening to me. Thank you for coming and sharing space with us today. Dulce, Cynthia, thank you for being here to continue to share with folks what the work currently looks like and how it can change over time and evolve as we know more. And when we know more, we can do more and we can do better. So look for that follow-up email, folks. You'll get the recording, you'll get the slides, you'll get links, you'll get the contact information from the folks that presented today. And I will see you all back in June, where we will spend some time talking about some communicable disease prevention and response work that's happening at OHA as well. Thank you for coming. Go out and do good work, and we will see you again. Thanks, everyone.
Thank you.
Thank you.